Welcome to the Worldwide Doula podcast. I'm Barry, I'm a registered nurse and birth doula, and each week I'm joined by a new guest speaker to talk about all things pregnancy, birth, babies, and parenthood. So it's time to sit back and relax as we get into some juicy topics. Hey everyone, welcome back to the Worldwide Doula podcast. Today I'm here with a power woman and a mumma of three, Gina Mundy. Gina is an attorney specialising in childbirth cases and best-selling author of a book called A Parent's Guide to a Safer Childbirth. Welcome to the podcast, Gina. How are you this morning?
Oh, I'm doing great. Thank you for having me. I know from our pre-show we're going to have a great conversation.
Yeah, it's going to be awesome. I'm really excited to get into it. Gina is joining us from Clarkston, Michigan, where it's bright and early, so thank you. In this episode, we're going to be talking about a topic that resonates deeply with many women thinking about their birthing options. We'll be talking about how to stand up for your rights and advocate for yourself during a hospital birth, and how you can prevent common problems and mistakes so that you and your baby can walk out of there healthy and happy. Gina, do you want to start by telling me about how you became an attorney in childbirth? Like, was it a personal experience that you had or?
So I knew from a very young age I wanted to be an attorney. I went through school, college, law school, and I'm like, okay, well, I'll be an attorney specializing in real estate because I had never ever heard about baby cases. They don't teach you about this in law school. I had no idea my profession even existed until I went to get my very first job right after I passed the bar exam. I went to a bigger firm. The real estate department was not hiring, but the people who do the childbirth cases were hiring. So I basically interviewed, I got the job, and my intention was to eventually transfer departments. But then in February 2003, when I started, I got my first case in, and I was like, oh my goodness, what is this? I'm like, something can go wrong during labor and delivery. And in that case, the baby was not born healthy, was permanently injured, and was like, what? I had just gotten married, having kids was on my radar. And all of a sudden, I just became completely obsessed because, again, nobody teaches you, no one tells you about this stuff. So I dove headfirst into it and became an attorney specializing in childbirth cases.
It's a huge area. Unfortunately, things do go wrong. There are people who don't know what to do after they've had a baby and something's gone wrong, and they just feel totally traumatized, and they're just left with this big, heavy burden on their shoulders and don't really know what the next step is, what they can do about it. So it's great.
And that's why I wrote the book, was for these families. We had a near tragic event in my family where my niece was having the first baby of the next generation of our family. And we went about 20 minutes during the birthing process, not knowing if the baby was going to be okay. We went through that time. I kind of went from this legal analysis, because this is what I do, right? Childbirth case, something goes wrong during birth. This is my profession. To this human analysis. And I'm like, this is how the families feel. This is the start. And I had like this connection with them, like, oh my gosh, because
Mm.
like no decision now can change the past. And
Yeah.
like, there's nothing you can do. You just wait. And it's the worst feeling ever. Eventually, we got word that baby was going to be okay. But I was like, oh my goodness. So it hit me like, wait a minute, I may not be around for the birth of my grandkids. And how I would prepare my kids for childbirth is way different than how a family may traditionally prepare. I went from basically being involved after a mistake's been made to trying to get involved before to help prevent these mistakes and complications, because they're reoccurring issues. They're common facts in these cases, meaning they keep happening over and over and over. So if parents know this going in, it can help them make those good decisions with their delivery team or their doctor or their midwife to help make sure the baby's born healthy. Because in so many of these cases, these families are, not kidding you, one decision or minutes from a healthy baby. So your
Mm.
decisions during childbirth are important. So being prepared, I can't emphasize that enough.
Yeah, being prepared makes a huge difference. Can you explain a little bit about the basic legal rights that a birthing mama has during a hospital birth?
Oh, absolutely. Listen, mom's in charge. So your delivery team, whether you have doctors or nurses, midwives, they give you options and it may be professional recommendations, but ultimately you make that decision. Doctors can't just come in and say, "We're doing a C-section and I don't care if you don't want it." Like that doesn't work like that. Doctors should come in and say they want to do a C-section, tell you why, and then give their reasons. And are there any other options besides a C-section? Same thing if they want to start something called Pitocin. Pitocin is used to induce mom's labor. It makes mom contract and that kind of jump starts everything. But again, they can't just start Pitocin without mom's consent. So it's really important that you understand. And I'll tell you, I say this to people and they're like, no, my doctor told me I had to do it. And I'm like, they actually didn't. It may have come across like that because you don't know any different. But as the childbirth attorney, I can tell you right now, they can't do anything without your permission. Now, they may push for one option over the other as their preference, but again, it's your decision. In my book, there's a very powerful story. It was about a mom and she had her first baby. She tried a natural vaginal birth, but it ended in a C-section. So, second baby comes around and her doctor wants her to try a vaginal birth. So if you do a vaginal birth after C-section, it's called a VBAC.
Yeah.
Now, the risk of having a VBAC is that where they went in for that initial incision, there's a risk that that old C-section incision will kind of pull apart during labor and delivery. It's definitely a decision that moms need to think about because here's the deal, your uterus is inside you where that incision is. Nobody can look at it and assess it. So nobody knows how you healed after they sewed you up last time. But anyway, and the doctor kept pushing for this mom to try a vaginal birth. The mom calls me and I said, listen, if it was me, based upon these reasons, I would unequivocally do a C-section. The doctor was so adamant about her trying a vaginal birth that she made this mom feel like she was making a bad decision by choosing C-section. So the psyche behind it and what was going on was ridiculous. But I kept telling the mom, you are the decision maker. Just go demand a C-section. Like, if that's what you want, go demand it. She went to her doctor and she's like, I want a C-section. The doctor's like, fine, I'll do a C-section because that's what that mom's in charge, not the doctor. And baby was born healthy, everything was fine. And then after the C-section, the doctor came into the room and told this mom something we'll both never forget, that basically when the doctor entered the abdomen, the uterus was paper thin. The baby's hair was sticking out of the old incision. So if she would have tried a vaginal birth, in fact, her uterus would have ruptured. And that is very, very bad for both mom and baby. So that doctor thanked her. I think it's a really powerful story. In every decision that you make, there's these different factors. So you're in charge. And if you want a C-section, you can get your C-section. You have 9 months to get to know your doctor. These are conversations you would go over during the pregnancy with your doctor. And if they seem like they got some pushback, like I had told the mom, you need a new doctor. Like,
Yeah.
I don't know what, but she was so late in her pregnancy at that point.
Yeah.
She's like, no, these are questions that need to be talked about like upfront with the doctor,
Yeah.
and then make sure that they are following your wishes because while that is true, some doctors can be very, very persistent and make you think you don't have the right to make the decisions.
Yeah, definitely. The medical team in general is always thought as the authority voice. And for people who don't know a lot about birth generally, they are thinking, oh, the doctor says that, that's the best option for me. But something that I always teach is mum intuition, listening to your body. This is your body. And maybe that woman was listening to her body. This was the little inkling in her head saying, no, don't do the VBAC, do the C-section. And that's really important that she listened to herself and she advocated for herself because a lot of people are really scared. I was thinking the other day, just a random thought. Out of all the jobs in the world, there are like jobs that if you say something, people just don't question it. And one of them is a lawyer and the other one is a doctor. And I'm sure there's a few other ones out there, but doctors have a really powerful stance in the world. And even as a nurse, like the other day, I had this situation where I had some doctor friends and we had someone who was injured. This was like completely unrelated to pregnancy. But as a nurse, I had one look at that person. I said, oh, that's going to be fine. I don't think there's anything seriously wrong with that. And the doctor, my two doctor friends said, no, what? That person needs to go to the hospital right now. That could be X, Y, and Z. And they went to the worst case scenario. And I was like, no, it's fine. That's fine. Like, if it was what you say it is, then it would have been more red, or he wouldn't have been able to walk on it or something like that. So I pointed out some issues and they were like, okay, well, that's why doctors and nurses work together, because they bounce ideas off each other and they have different viewpoints.
I love it. You are right on with the doctors and they say things. And just to go off that, here's the scariest part of what you just said. Because A, it's true. B, when it comes to childbirth, doctors do not agree. I exist because doctors do not agree. I will retain two doctors to look at mom and baby's medical records. And one doctor will tell me everything was done perfect. And the other one will tell me everything was done wrong. Okay. So, yes, they have this like authority where people listen to them. But the problem is they all have their individual opinions. And you could ask one doctor one question, another doctor the same question, and you will get two completely different opinions. I was so confused when I started in this field. I started asking doctors, I don't understand. You're telling me one thing, this other doctor is telling me another thing. I'm on the record during depositions trying to like piece things out because I'm like, why do you disagree? And all they do is just dismiss the other doctors being crazy. So just be aware, different doctors, different opinions.
Yeah, definitely.
So no, I love that you
Yeah.
said that. That's perfect. That's so true.
I keep seeing it all over social media. All my birthing related accounts that I follow, they're always like, look out for the red flags. When you choose your doctor, make sure you look for the red flags, because the story that you said before, that was a major red flag. The doctor was pushing her to do something and not really listening to her. And doctors have different opinions. Some people are pro VBAC and other people are like, no way in hell. You've had a C-section, you're having another one. You're not even
Right.
trying to have a VBAC.
Mhm.
It's
And
just
by the
lack
way,
of
you said one other
education.
thing. I just love talking to you because you're so smart. And you'd say really great things, but you're right. When women need to follow their intuition, that mom, her instincts were on the side of C-section. Like I
Mm.
wrote that in the book, exactly what you said. Just so you know, you are 100% right.
Why do we trust our instinct with everything else, but then when it comes to childbirth, it's thrown out the window? It still surprises me. Yeah. An intervention could even be something as simple as the doctor coming in just to check on you and just having somebody there to say, no, she's just going through a contraction right now. Can you just stay outside for a minute? Can you come back in a little bit? Everything's fine. Something like that. If you don't want to have that continuous fetal monitor on because you want to move around and that's what you feel is best for you, then speak up. You know, this is your birth. This is your experience. They're just there just in case something goes wrong. And I love that we're moving back towards a birthing culture where women are trusting more in their bodies, because we've lost a lot of trust in our bodies. And like, have a
100%.
hospital birth, but trust in your body. You can do this. My most recent episode that I released was actually with a lady that I spoke to about her birth story. And she said she got all the way into the hospital, like after an hour drive, and she was 6 centimeters stretching to 8 centimeters. And she said to the nurse, is this going to get worse? You know, she's just about to go into transition. Transition doesn't last very long, but it
Mhm.
is the most intense part of your labor. And the nurse said, yes, it's going to get worse. It's not a lie, but she didn't trust that her body could actually just get through that last little section. And she asked for an epidural. Thank goodness, you know, she was very happy that the epidural didn't arrive in time, but still, she lost trust in her body because she went through that transition, which is very normal, is very common. But having somebody there to remind you that you should trust in your body is really important. Yeah.
100%. It's nice knowing this stuff ahead of time
Yes.
because, like we talked about during pre-show, when moms enter the state of labor, It's the one time where it's okay to be in a bunch of pain, but it also takes you into like a different mindset too. So
Yeah.
I think
Yes.
talking about this stuff beforehand really helps with that element of surprise, because when you have that element of surprise, it's hard to focus too.
Yeah.
I just love going through this stuff and making sure moms know options and they have a good understanding of what their rights are and what they can do during childbirth beforehand, so they could just go with it, they can relax.
Mm. What are some steps that a birthing mama can take to ensure that her voice is being heard by her birthing team and her medical team?
So, when we have these childbirth cases, when something went wrong during the birth of a baby, it's the delivery team's care that is at issue. It's the part of the case that's analyzed more than any other aspect of the case. So, your delivery team is very important. But I think one of the most important things is if you're not a fan of somebody on your delivery team, now listen, your doctor is head of the delivery team. You had 9 months to figure that out. So, I have a chapter on doctors and working with your doctor to make sure they are a good fit for you, not only during pregnancy, but during childbirth. But going to the hospital and listen, there's situations where you get a nurse, for instance, and you're not a fan of your nurse. You got to advocate for somebody different. And I give the example in my book. We had a case, and there were two nurses that day. And one nurse, she had 20 years of experience, and she was literally just born to be a labor and delivery nurse. Like, she loved her job. She was amazing. I mean, you could see it when you talked to her. And then there was this other nurse who had just finished training, hated being a labor and delivery nurse, and was looking for a different job. That day when the patients came in ready to have their baby, it was luck of the draw on who got which nurse. So it's important that if you walk in and you get maybe that nurse who hates her job, listen, the people at the hospital already know this, but they need to staff with people. So sometimes if you just say something, maybe to another nurse or a charge nurse or something like that, they can get somebody else to replace that person on your delivery team that you're not a fan of. So, bottom line, your delivery team is huge. And in most countries, whoever is on your delivery team, really with the exception of your doctor, it's who's scheduled to work that day.
Mm.
Unless you have a doula. We talked about this during pre-show, how amazing doulas are. While writing this book about a year ago, somebody was like, well, what are you going to say about doulas in your book? And I'm like, I just really don't know too much about doulas. So I put like a short brief, a few sentences in. And unfortunately, it was after I published the book, as I've gotten to know doulas and what they do for their patients and how awesome they are. Wait a minute. Childbirth attorney who only sees mistakes and complications during childbirth knows nothing about doulas. Ding, 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 ding. Because doulas are helping these families bring babies safely into this world. Otherwise, they would be in my cases like the doctors, the nurses, the midwives, the anesthesiologists, the residents, or the doctors in training, but they're not. And so, I've asked a couple other baby lawyers. I'm like, hey, do you guys have like doulas in your cases ever? And they're like, no, no, we don't really have doulas in our cases, but doulas are out there, and a lot of families do have doulas.
Yeah.
So I've turned into this advocate for doulas because delivery teams can't focus on you 100%, where your doula is there by your bedside, advocating for you. They speak the language of your delivery team, and you get a good doula. Wow, that's a great advocate for you. And then you have the comfort of knowing you have someone like that on your side, and you can actually relax and do what you need to do to physically and mentally deliver your baby safely. So I think getting a doula is amazing. But also, one other really important thing that they can do is read chapter 11 of my book. Chapter 11 goes over the common mistakes and common complications that occur during childbirth. So I think actually I've already said in the podcast, but sometimes these facts and issues are reoccurring. They're the same ones.
Mm.
I've had doctors call me and they just start talking about a case. And I'm like, which case are you talking about? Because these are the same facts in my cases. And it's scary. So if parents understand, these common issues and common facts, and then something like that arises during, their labor or delivery, they're going to have this heightened sense of awareness. They're going to ask the questions, and they're going to know that their decisions during this time are super freaking important. The number one most common fact and issue in a legal baby case when something goes wrong is Pitocin. I have seen the Pitocin inductions gone wrong since February 2003.
Isn't that so
So
interesting?
yeah. So while Pitocin scares the crap out of a baby lawyer like me, doctors are fine with using it. So they may make that recommendation. So then I wrote an entire chapter on basically from everything I've seen gone wrong, how to have a safe Pitocin induction. And here's the deal, like we just talked about with doctors having different opinions. You have a good doctor, they may just be like, yeah, we already know all this. Well, other doctors don't. They run their Pitocin inductions differently. When things go wrong, Pitocin a lot of times a culprit. So yeah, and then there's other things in there that, I think every family would know to help them make those good decisions. I think one of the biggest things families can do, and I've said this a couple of times, like prepare for childbirth. Everybody wants to pick out the cute clothes and are we going to breastfeed? And I'm always like, you need to get ready for childbirth.
Yeah.
I know like a lot of people are talk about birth plans, and I do talk about preparing a birth plan. If you want to roll up to the hospital with a birth plan and give it to, your delivery team, that's great. For me, it's more of the act of preparing in the comfort of your own home where you can go research stuff, you can read books, you can listen to great podcasts like yours to help get that information just so you're ready. So if you need to pivot or make a decision, you can do it without skipping a beat. And also, it's really important that you stay very relaxed during childbirth. So just being ready, especially if you have a doula, you're sitting pretty. You're going to set yourself up for that powerful moment when you get to hold your baby for the first time, look into their eyes and feel their skin, because there's nothing better.
Yeah. Another huge aspect of preparing is educating yourself so that you can understand what's happening. I feel like I'm just repeating what we said, but like it's so true to
And important.
understand what's happening at every stage in labor so that you can trust in your body. Okay, this is almost over. Maybe it's going to get worse, but it's not going to be very much longer. Pitocin is so overused, just as epidurals and all that stuff. Like there is a time and place for all of these interventions, but just because you've hit 40 weeks doesn't mean that you need to have a Pitocin induction. There is an argument your baby and your body will work together, and then once the baby's ready, it releases certain hormone and then you go into labor. There is that argument. And then there's also the argument that the longer that you are pregnant and the later the gestation is, like 42 weeks, 43 weeks, there is the argument that things can go wrong, which is why doctors do push Pitocin and inductions. But actually, it's really interesting that they have moved the official due date to 40 weeks when it's actually 42 weeks is your due date. And it's not even like that accurate. End due date is only an estimation. And being educated about these things can make a huge difference. And making a birth plan that is flexible, having plan B just in case A doesn't go to plan. Birth plans are great in the way that they let the birth team know what your ideal birth is. It doesn't necessarily tell them exactly how it's going to go because no birth sticks to the birth plan. And it's not always about the actual birth. I always make my birth plans more than just the birth. It's what happens to the dog when you go into labor? Who's going to look after your dog?
Oh, I like that.
And then,
I should have included, I love that. That is so
yeah,
true.
like it's
Poor dog.
everything to do with labor and birth. Like, it's also what happens after the birth. If you want to do like a breast crawl or whether you want to have delayed cord clamping, or there's so many different things that you can choose. There's so many different options. So I think it's good to have a birth plan. And yes, rocking up and just giving the birth plan is not a sure way to have the birth that you want to have, but definitely lets the birth team know, because most of the time if you rock up to the hospital and you don't know the midwife on duty and there might be some other stuff that you've never met before, at least they know a little bit about what you want and a little bit about you. So
Oh yeah, it's
yeah,
great.
yeah,
For those reasons, 100%. It's a great idea.
yeah. So you talked a little bit about Pitocin. What are some other common problems that you see in a hospital birth?
So a big one is actually when the labor and delivery units are busy. So it's really important to understand that if you have like a really busy labor and delivery unit, your delivery team, your medical team is going to be running hard and they're going to be thinned out and you're not going to get that attention that you may need. So that's when it becomes really important to work with your delivery team to be educated on childbirth. So if you need to alert them, ask them a question if you think something's wrong. Because here's the deal with the delivery teams. If you alert them that something's wrong or something, and something really is wrong, you're going to be the priority patient. So we had a really sad case. I mean, this is so sad, and I'll just go real general. But basically, mom comes to the hospital. The unit is busy as busy can be. They put her in a room. They start the fetal monitor and there's concerns about the baby. The delivery team comes in, they assess mom, they assess baby, they do some type of, like testing interventions, and they're reassured that baby's okay. Not the best, but they're busy. Also with fetal monitoring and the baby's heart rate, because baby's inside you, it's really hard to assess baby and see how they're doing. So the best way doctors can do that, or your delivery team, is by looking at their heart rate. So as a childbirth attorney, the baby's heart rate was the first thing I learned how to read. And I can look at a baby's heart rate and it will tell me if baby is a rock star and doing great, or the strip's going to tell me if baby's doing bad. So this is very important, and parents need to have a basic understanding of how to read the baby's heart rate. Anyway, that day at the hospital, the delivery team is reassured enough about baby. They leave the room. It's mom, dad, grandparents, and the baby's heart rate stops graphing. The family, the grandparents, they don't understand the importance of having that heart rate continue to graph. So the delivery team's out, they're busy, they come back a while later and they're like, oh, where's the baby's heart rate? And they're like, yeah, it stopped graphing, because the family didn't know that it should continue to graph. And they try to find the heart rate and they can't. So they call the doctor and the doctor brings in an ultrasound. They put the ultrasound on mom's belly and they look at her and they're like, your baby passed away. So it's important that when you have a busy unit like this, that you have a basic understanding, making sure that monitor is on mom. And not only that, if it stops graphing or starts getting like funky or something happens, they would know they need to go get the delivery team. You know what? And the same thing with the doula. If they had a doula, the doula would have been like, hey, speaking their language. So there could have been a different outcome. Another common fact in the baby cases is that when something goes wrong or there's a mistake or a complication, it's after mom's water breaks. So after mom's water breaks, the environment changes. Baby's been chilling in amniotic fluid with its lifeline, the umbilical cord, the placenta. When that fluid comes out, it changes the environment and can make baby more vulnerable to something happening. But the important thing about that is if your doctor comes in or midwife and they're like, hi, we'd like to break your water. Again, mom, you're the decision maker. You can say yes, you can say no. So if they want to break your water, you have to ask questions. So you have to ask, do you want to break my water because you want to be home for dinner? Or do you want to break my water because there's a medical reason? And see what they say. In these cases, I've heard both. They come in at 7 a.m. and they break the water if it's appropriate because they want to be home for dinner. There will be GYNs. So it's important that you ask these questions, because once that water is out, that baby's environment is changed, and it's really important to keep a close eye on baby. So another one, residents are doctors in training, but they have a lot of responsibility at the hospital. They're also responsible in many hospitals for communicating with your doctor. So your doctor is making the recommendations, but they're not at your bedside. They're listening to the residents. They report to the doctor their findings, what they see and whatnot, and the doctor makes recommendations. But unfortunately, because they're inexperienced, they may not be communicating accurately. And that's happened in some cases. So yeah, but here's the deal. If parents know this stuff going in, it's just having a better understanding of what to expect, staying calm, understanding that when things go wrong, these facts are sometimes present, I think is just huge. So learning about labor and delivery is so important. So chapter 2, I go through the basic facts or foundation on what I believe every parent should know before childbirth, like childbirth 101. But if you know them, I think you're going to make way better decisions.
Mm.
Good
So,
decisions equal healthy babies.
yes, that's very true. And it's normally the first time mums that are taken advantage of by the doctors. Oh, personally, one of my first friends who started having babies quite a while ago, she studied midwifery, and she said one of the things that she saw, she stopped studying midwifery because she was like, it's brutal. I don't want to be in the hospital and supporting that system because it is
Mhm.
really rigged sometimes.
Yeah.
But she said that one of the things that she heard at the nursing station was the doctor would come in and be like, all right, who's our first time mums here? Who's been laboring longest? Okay, let's schedule that one for a C-section. Let's get her through because I've got a dinner to go
Ooh.
to. And the first time mums, they don't know a lot. Most of the time, they're not educated. They're just going by what the doctor says. And then they are told that, okay, if you say no to this C-section, here's a form to sign over the rights. And like, if something happens to your baby, it's all on you. And that's really shocking.
They call them AMA. Yeah, going against medical advice. Yeah.
Yeah.
Don't be scared of that if that happens. That mom that I told you about with the VBAC, she was AMA, and the doctor thanked her for not listening to her. So just very important.
We have lots of people going against medical advice, but we always have to inform the person about the consequences. A lot of people use scare tactics. Oh, if you don't do this, then this is going to happen and it's going to be really bad. But they don't give
Mhm.
them all the facts. They just give them the facts that are in favor of them choosing the option that the doctor wants you to choose. So I want to talk about consent quickly. Something really simple as like being checked for how far you are with your cervix dilating. That is something that you have to give consent for. They can't just come in, put a glove on, and be like, all right, let's check you. It's huge.
I know where you're going. It's informed consent, and it
Yeah.
is like a big issue in cases. Informed consent means they're supposed to inform you of your options, and then you must consent to whichever one you want. You're definitely signing a consent form for a C-section.
Mm.
So you're not going to sign something for every procedure.
Yeah, there are 3 levels of consent. There is implied consent. If you give your arm,
Mhm.
as you know, somebody says, oh, can I check your armband? You give them your arm, and then that's implied consent. You're saying yes, like without saying yes. And then there's verbal consent,
Right.
and that's you actually saying, yes, you can do that. I approve that you will do that. And then there's written consent where you have to read a form or sign something and to say that you've
Oh, yeah.
acknowledged. But yes, yeah, I think the huge part is actually the part of informing them and the doctor actually saying, these are your options and what are the pros and cons, what could go wrong, what could go right, what are the things that you need to know before you consent to this. So, what steps should a mama take if she feels like her rights are being violated or ignored?
Yeah, it's always crazy with childbirth because it can be intense having an advocate for you and baby because it's so important that you stay calm, your body's relaxed, you're going to have a way easier time getting baby delivered and whatnot. Grandmas make really great advocates, expecting grandparents. They're older, they've been through it. If you don't feel like they're listening to you or they're doing what you want, it's hard. So just having like a designated person there, they would definitely come into play. But I think just keeping in mind, you are the decision maker, staying strong, requesting if there's somebody who's really not listening to you, if it's a whole entire delivery team, I'd be surprised. It's so unique to every hospital system, delivery team on what you can do. But I think just staying strong in that moment and having an understanding that you're the decision maker and they can't do anything unless you give consent is very, very important. And then having an advocate backing you up behind you is huge. even somebody like you, because you know so much, that you would be like a great resource, even if you were remote and you could help guide them with all of your knowledge and experience. That's huge. So yeah, there's definitely different ways and different things that parents can do. I can tell you in the moment though, it is hard. So it's almost like preparing to make sure your decisions are enforced and stuff like that. I think is probably the best thing you can do.
I remember working at one
Mhm.
of the hospitals in, I can't remember whether it was in Lismore Base Hospital or whether it was the Queensland Children's Hospital, but I'm not sure if they have it in the US, but it's something that's just within the hospital where the patient, if they feel like they're not being listened to, they can call a certain helpline. And it's the same level of escalation as like, the big red button on the wall. If some emergency is happening,
Oh,
you press the big
good.
red button. It's the same escalation as that. Everything has to stop. You're not allowed to do anything until this patient advocate person comes in, and it's a person from the hospital, and they come in and they basically assess the situation and be like, okay, what's happening here? They sort out the situation. And I think stuff like that is so great. If they had something like that in every hospital, I'm sure that the childbirth cases, one, probably a lot safer, two, women will not be coming out of there traumatized. Like the stats are insane. 1 in 3 women or something like that come out of their childbirth having some sort of trauma, whether it's physical or emotional or mental. Yeah, it's really
I didn't realize
crazy.
it was that high. That
Yeah,
needs to be fixed.
for
But that's
sure.
scary.
Yeah, and I think it's definitely something that we have to take action on because I don't want to be having my babies and going into that same system that people are getting traumatized with. It's not the doctor's fault. It's not the patient's fault. It's not anyone's fault necessarily. It's just the system. Sometimes it just doesn't work. The system is flawed. And we just need to educate ourselves so that we can be more aware so that these things don't happen and we don't come out traumatized. Yeah.
100%.
Yeah. I want to quickly talk about emergency situations. When an emergency situation occurs, what kind of things should the parents be aware of in those situations?
So if there's an emergency in childbirth, it's typically they want to do like something called like an emergency C-section, stat C-section. Usually it's mom's going downhill, well, baby needs to come out ASAP. It's important that you try to evaluate, is it a true emergency? So if everybody's moving fast, everybody gets really hyper, this is an emergency. You can almost read your delivery team. I actually had a C-section and my delivery team went from how you feeling to people flooding into the room, starting to unhook stuff, and we're talking fast. And it's important to try to stay calm because if your delivery team's moving that fast, they're moving to get your baby out quick. So if they're moving towards that, then that's the best thing for baby if it's a true emergency. Now, if your doctor comes in and like, well, we're going to call an emergency C-section. We just think it's best for baby. That is not an emergency. Like they get really
Yeah.
hyper. They get
Yeah.
really hyper during emergencies,
Yeah,
and they
they do.
should. And that's because they want baby healthy, they want mom healthy. So you can really just look around the room and determine, is this a true emergency or not?
How does consent change when an emergency happens? Obviously, there are
Still have to
some.
give, yeah. So if they're going fast, dad may sign, you have to give consent, but it's going to be a quick consent. So it's important to understand, what is a vacuum? What are forceps? What's the benefit of one over the other? Because for instance, forceps, vaginal trauma, but forceps are going to make sure that baby's delivered. Another option, if there's an emergency, would be something like a vacuum. Vacuum doesn't have the trauma to the vaginal area like forceps do, but they're not as reliable in getting baby out fast.
Yeah.
You got to prepare for an emergency by asking your doctor, okay, so if there's an emergency and baby's not coming and you have to do a vacuum or forceps, which one are you going to use? What happens is the vacuum goes on the baby's head. It's like a suction. But once that vacuum pops off 3 times, they have to convert to a C-section. That's a lot of time when baby's not getting oxygen. And unfortunately, those are minutes that matter. Where if there were forceps and baby did come out, even if there's vaginal trauma, you have a healthy baby. So it's important to prepare by talking to your doctor about the different types of decisions that may be made in an emergency. Make sure you guys are on the same page. It's Murphy's Law. If you prepare for an emergency, it's not going to happen. It's when you don't prepare. But just having that conversation with your doctor. In emergency situations, the consent, yes, may not be great. Preparing for the possibility of an emergency C-section is going to get everything moving faster because they can't do anything until you consent. So if you know your options and you have an understanding, then you consent faster and they can move without skipping a beat to get baby out of that environment.
Yeah, very true. Sometimes in those scenarios, this is dad's experience too. This is also family's experience. If your family's there, they're probably going to be as wrapped up in the whole situation as you are. And sometimes they can't even think with a clear head. Having someone outside of the family to educate you in these moments and help you make these decisions, very valuable. And it might not be a doula, it might be a best friend, or it might be asking the midwife that you've had. In Australia, we don't really have obstetricians in charge of going along with our birth as much as the US does. We normally have midwives in that position. If you go privately, you do have an obstetrician that follows you through, but most of the time it's a midwife or like a group of midwives. So sometimes the midwife will come and be there with you during your birth, having them there and asking them questions. Hey, what do you think I should do? Sometimes can really help you make that decision really fast, because sometimes dads are going, I don't know, I want to support the mum and this was not in our birth plan, but I really don't want to make the wrong decision because she's going to hate me for the rest of my life if I make the wrong decision.
Yeah. Yep.
So sometimes it's really valuable to have that extra person who's not family and not as emotionally invested as you guys are. Gina, it's been wonderful to talk to you today. I've learned so much. It's been really, really great. It's so important to know these things. So many mamas are coming out of their birth traumatized just because they don't really know their rights and they don't know a lot about their options. And the medical team sometimes takes advantage of that. So, yeah.
Oh my goodness. Thank you for having me. And I do want to say one more thing. I have some resources for expecting parents. Chapter 1 of my book goes over the lessons learned from the baby cases, whether it's from the families, the medical experts, the delivery team. I have that chapter for free on my website. So thank you for having me today. This is a great conversation. I love that you're trying to help moms out there be happy and have healthy babies. So thank you.
Yeah, it's been wonderful. You can find Gina at Gina Mundy on Instagram or through her website, ginamundy.com. If you're enjoying the podcast, make sure you give us a follow and rate the show. And if you know someone who you think needs to hear this episode, give it a share so we can spread the word and educate more mamas and women worldwide. And we'll see you next Monday for another juicy episode. For more information on pregnancy, birth, and parenthood, head over to my website or Instagram at blissfulbirth.co. And just a little reminder, the information contained in this podcast is here to educate and empower and does not replace the advice of your own healthcare provider.